Welcome back to Healthwise. I'm Joey Pop. We're having a great discussion on preparing your child for anesthesia. With us, Dr. Brent Holway, Dr. Barry Stowe, and Dr. Richard Evack. The medical team comes from Southeast Anesthesiology Consultants. And before we go any further, Southeast Anesthesiology Consultants, that is the umbrella for what many of our viewers may know as Southeast Pain Care, correct? So there's a relationship there?
Yes, some of the physicians in our group have special training in pain management, and they work in the pain centers. Mm-hmm. Some do strictly pain, some work both in the operating room and in the pain centers. And this group, the three of us, we do not work in the pain centers at all. We work strictly in the operating room.
Okay. Because it's kind of like an oxymoron when you say pain, and all of a sudden I'm going to think about being put to sleep to go for an operation. I don't want to think about being in pain, do I?
No, none of us want to be in pain. In fact, that's one of the greatest concerns of patients, that they feel like they're going to hurt and their pain is not going to be addressed. And what we tell people is, you know, whatever the operation, we will work with them and devise a plan to make them as comfortable as possible.
Right.
And our goal, if 10 is the worst pain you can imagine, and 1 is no pain, we expect them to be a 2 or a 3, you know, at the end of this process. And we do have to administer additional pain medications and recovery to get them to the point where they're comfortable. But that's all, again, individualized for patients and their procedures.
And the bottom line is that the patient is going to be comfortable. And we said earlier in the show that perhaps one of the side effects to coming out of surgery is that the child may say, "Oh, my throat's scratchy, Mommy, Daddy." What causes that? Is that because of the machinery or the hoses that go down?
That's usually a side effect from the breathing tube that is placed once they become unconscious.
By the way, do you do that, or does someone else in the medical team do that?
Part of the anesthesia care team places the breathing tube, whether that's the anesthesiologist, the physician taking care of the patient, or the nurse anesthetist that we work with in the operating room. One of the two of us place the breathing tube once the child is unconscious.
What's the #1 question parents have for you when they come in? Dr. Evack, let's start with you. That I haven't already asked.
That you haven't already asked. The #1 question, I guess.
You gonna take good care of my kid?
I guess really 2, probably. 1, the separation piece that we addressed earlier, and that we. You want me to repeat or?
Sure, let's do. We may have some new viewers here the second half of the hour.
You know, part of our job is to allay the separation anxiety from the child to the parent, and we use different techniques. And we talked about this earlier. One, we have child life specialists that help us build rapport with the children. We showed a segment earlier with one of our child life specialists. We use medications that are anxiolytic or allay their anxiety and give them amnesia. And we deliver those in several ways. One, orally.
Now, wait a second. What does that mean? So the child won't remember the experience?
So the child won't remember separating from the parents and actually going in the operating room.
Okay.
Or very little about that. And that's the
that's a key.
Amnestic amnesia, a word people might commonly be aware of. So we deliver those in different ways for younger children. We give them nose drops. For a child that will take a drink, we'll do that orally. Or sometimes, if they'll do neither, a little intramuscular injection. So I think the separation anxiety is one. You know, I think safety is another, and we tell them about the risk of anesthesia, but tell them that the 3 of us and many of our colleagues are specially trained to take care of children. And then the third thing is, will my child be in pain afterwards? And we didn't really touch on this earlier. You mentioned chronic pain. Chronic pain is a whole subspecialty of anesthesia. People that go to the pain clinics, but those are people with chronic or long-standing pain conditions.
So this acute pain, will they be in pain?
Or cancer pain. We use different techniques depending on the surgery that the child is undergoing. For simple things like tonsils, it's often intravenous narcotic pain medicine, like morphine, for example. For some other surgeries in younger children, we do little local anesthetic injections called a caudal block, which is similar to an epidural, I tell parents, and most of the moms who've been there have had epidurals for the childbirth, but much simpler. and it allows the child to be awake with less pain, and for us to use less narcotic pain medicine.
Great.
But going back to pain medicines, just so people in the audience understand, there are really 3 classes of pain medications. There are narcotics.
Yep.
There are non-narcotic pain relievers, and they're really Tylenol and non-steroidals, of which ibuprofen is a great example, a common example of a non-steroidal, and local anesthetics. And we use those in combination to try to keep people comfortable. And so if we can use a non-narcotic analgesic, it's appropriate. We use that. If we use that in combination with a narcotic and a local anesthetic, we mix and match those medications to try to relieve a child's pain.